Okay, so we thought we could have some fun today and actually give people some information or education about how a dental office kind of gets run. The main thing is that I just want to show everybody that dentistry can be pretty painless. There's a lot of new technology, state-of-the-art facilities out there that can make a patient experience very pleasurable. So I just kind of want to make this fun, make this easy. We're kind of just winging it, but at least it's a fun way for you guys to kind of see the inside of what's happening at a dental appointment. So come on back and we'll do that. So come on back to the office. We've got people working like Harry and really easy. So a couple of things that we do is we want to make patients feel comfortable as far as being in the room. So we try to have everything just a little bit, the light's not too intense, trying to remove some of that medical feeling, but everything being very clean, comfortable for the patient. So for us, we offer blankets and pillows and dark glasses, headphones, and then also patients could, if they want to, could get some paraffin hand wax treatment if they wanted to do that as well. So I'll just give you a little sample of what's going to happen here. So some of the things that we do is we do a lot of digital photography and we do intraoral cameras. And what's nice about that is that we could share with the patient what we're doing and then what a before looks like, what a during, what after a procedure looks like. So this is our patient Shara. Hi Shara, how are you?
Hi Doctor.
Thanks for doing this for us. So what we want to do is just kind of share with everybody what a patient experience is like. And just for right now, you have a cracked tooth, it's bothering you right now. So the diagnosis is pretty much a fracture in the tooth. We're going to prepare it for a crown, and we're going to be using our CEREC technology to do that. So we're going to be scanning it. Since you are symptomatic, we are going to do it a little differently and keep you in a temporary for a little bit just to make sure the symptoms calm down. And we'll bond it. But typically what we do, if it's asymptomatic, if we do a crown, we can do it in one visit. But in your case, I think it's good that we'll just temporize it, see how the tooth settles down, and then we'll rebond it next week if we want to, okay? So a few things that we have is we have a nice blanket, and she's of course on her paraffin. We have nice towel here to protect her, eyeglasses to protect her, neck pillow, and headphones. She can watch a movie or watch TV while we're doing this. A couple things that we're going to do is her numb. So I'm going to wash up and then we will be right back and show you what that process is. And we're gloved up, protected. What we like to do before, because I know everybody's very scared of the dentist because they're scared of the shot. So just want to make everybody feel really comfortable that the shot could be painless. So basically, I have a pharmacist that makes our compound, and what we do is it's a topical anesthetic, and the topical just goes right where we're going to give the injection. So we leave that right there for a good few minutes.
Where's the other set of headphones? Because you're doing injections.
You doing okay, Shara?
Mm-hmm.
I just hold it there, and that's what most dentists do, is just have a little bit of topical computerized anesthetic system. And what's nice about it, it doesn't look like this. This is very intimidating here, and so I like to use this system on pretty much everybody, but also for kids, pedo, because kids don't like to see this. For the most part, I can use it for all of my patients that I've seen for years because my injections are pretty painless. So, and just to show patients that there are advances in technology with something like this. So this is a lot less intimidating. It's just a little needle that we could remove the tip on it. You could order different sizes on it. So for this case, we're just going to show, just for purposes of how painless this could be, is we're going to go in. And it's a lot less intimidating, like we said. And we just go in where the topical is. And if you look over at the computer there, are you doing okay, Shara?
Uh-huh.
Okay. And all we're doing is delivering the anesthetic through the computer. What's nice about it, the computer releases the anesthetic at a very comfortable pace. And so it allows the tissue to not have so much trauma with the liquid, so it comes out in a nice easy pace, and it's very comfortable for the patient. So. Okay, So Sherry, I want to ask you, how was the shot? I guess the anesthetic.
It was absolutely painless. I really didn't feel anything. I felt more when you were putting the topical in, and it was just that was not uncomfortable at all.
Excellent.
So yeah, it was a really amazing injection.
It doesn't have to be painful. So great, excellent. Thanks for sharing that with us. So another advancement I just want to share with you guys is that we've had for years, but it's an isolite, and it is just. We love it. It's one of our favorite things in dentistry because a few things. It protects the patient's cheek and tongue from the area where we're working. It allows them to rest their jaw on this bite block. It suctions, it's a high volume suction. There's also a light attached to it so we could have better vision through it. So overall it's wonderful because it's very protective, and it's helpful for us because we have a really good field of view. So I'm going to show you guys how it's placed. So basically what we do is have patient open, and I think sure, and we slide it right in, and the cheek is protected to the right, and then we'll go ahead and relax your jaw. Perfect. Excellent. So see, so this is beautiful. This is so nice for any dentist, dental assistant to have great access and great view. We have the light here that we can turn on, and then look at that, it suctions for us, which is great. So then they don't have, you know, all the saliva and water going down their throat. So it gives me a great clear vision. So that is a great advancement for dental technology for us. So we're good with that. So we're going to get started with our crown prep. And as soon as we get that settled, then I'll show you how we're scanning onto our CEREC machine, okay? Okay, so now her cracked tooth, remove the crack, remove the old filling, and prepped it. And so now we're going to, some of the new technology is we are using a CAD-CAM. This is CAD-CAM technology. And what CAD-CAM does, it's a digital imagery. And so what we can do is make crowns through the computer now. And so what we do is we have a camera access here. And what we're going to do is just take some pictures of the tooth. Sorry if that's something. Some of the new they have new technique with what's called the OmniCam that doesn't allow powder, but we're still on our powder system here. Yeah, so we've got a nice image there. It gives us a great image. And then what we basically do is do scans of her mouth, so no impressions, which is nice. And then I'll be able to design a crown or onlay. We'll call it an onlay since we're able to be a lot more conservative on this and make a new tooth for her. Okay, so we finished the prep. Shira is now temporized. She's comfortable. We want to see, since the tooth was symptomatic, we want to see how the tooth is doing before we bond the permanent in. So she's gonna let us know how we're doing here. You did fantastic.
Thank you.
Yeah, you did really good. We finished everything within an hour, so it took us an hour to do this appointment. We have a nice warm towel for you there, which is
so
nice. Nice to always have. So Shara, tell me, just to let people know how your experience was. So how was your experience as far as getting a crown prep done?
For having any dentistry done, it was amazing. I felt like I was in a spa the whole time. I had music playing, I had a blanket, I had excellent care, I was comfortable, I didn't feel the injection, and I was actually really happy to be here. So it was much better than I could have even anticipated.
You're good and great. And then how was it the feeling of having the isolite, because we wanted to show that as a new technology, just having that in your mouth? Did you feel protected that we were able to get in there and get the dentistry done?
Absolutely. I didn't feel like my tongue was going to be in the way. I didn't worry about keeping my mouth open for you. That's always a concern. And honestly, I was so comfortable, I was worried about falling asleep. So it was nice to have that in my mouth in case I did.
Yes, and we actually have a lot of patients that do fall asleep in the chair. So thank you for sharing your experience. We just wanted to let people know how easy it could be to get dentistry done, pain-free and easy with great technology that surrounds us, and that's in the area with many dentists out there that have isolites, and they have STAs, and they have CEREC. There's just so much great technology for patients to have and experience, and the main important thing is in a comfortable environment. So,
yes.
So thank you.
Thank you so much.
All right, okay.